there's medicine and then there's alternative medicine is to ignore one side or the other.
We're a group of physicians first that incorporate acupuncture into our medical practice.
Their regular doctors want to learn acupuncture much as if they were going to learn any other specialty discipline in medicine.
My decision to study and practice medical acupuncture was not a decision against traditional drug-based therapy.
The way to come out ahead is to blend and integrate and to capture the spirit of what's best in both approaches. So we want to have the best of both worlds.
Medical acupuncture is on the leading edge of the American healthcare revolution. Medical acupuncture is often associated with pain control, but it has much broader applications for preventing illness and promoting health and well-being. The World Health Organization acknowledges acupuncture as safe and effective treatment for a variety of medical conditions.
Medical acupuncture differs from just acupuncture in that it's a melding and a combination of Eastern medical philosophy and Western modern technology.
The technique I use is based on the human nervous system and its structure and function.
Acupuncture works whether or not you believe in any philosophy. You don't have to believe in any Eastern mysticism or Eastern religious thought for acupuncture to work.
I think of it as an extension of my role as a physician trained in conventional Western medicine.
It's a paradigm or a system of medicine that enhances the ability of the body to heal itself.
The cause and effect relationships that we see in treating patients with acupuncture, to me, are very normal physiologic responses.
Those little needles sticking in there, I mean, they're not kind of magic bullets. They're just giving clues to your body about to pay attention to something that has not been doing a good job paying attention for.
The needles are very important. They're sterile, they're disposable, and do they hurt? Most people say they, in most cases, don't even feel them entering.
Almost everyone that's been under acupuncture treatment will have a sensation of either euphoria or calmness or maybe both.
It's almost like putting in a computer software program in the body, using the needles as switches. Traditional drug-based therapy taught me to treat the problem that the patient had. But medical acupuncture has added to my life and to my treatment was it allowed me to treat the patient who had the problem.
To take the needles and place them intelligently and in a series of treatments have a patient that is either less in pain or no longer in pain it's a considerable privilege to have that tool.
Nothing in my medical training had prepared me for when I was in the HMO and patients were coming in. I need my codeine pills because otherwise my headaches will make me sick and I have to keep doing this. I think, why are people taking narcotics all the time? And these weren't drug addict people, they were just normal people trying to make it through their life.
I want to treat these people that the interventional system doesn't want to treat or can't treat or is unwilling to treat because they don't see anything to treat.
The patients are as excited as I am by the fact that their stories make sense all together, finally, to one doctor.
I've spent over $10,000 of my own money, Lord knows how much of the insurance company's money, to try to get rid of the pain.
I started last year. I was working in a restaurant and I slipped and fell in the kitchen and hurt my back. They sent me to a neurosurgeon to do some testing and they did some spinal blocks. By January I was crawling across the floor. February I was locked into a 50-degree angle and then they started talking surgery and I panicked.
When I began acupuncture, to be quite honest, I was skeptical. So my first treatment, after about 20 minutes, and any of the pain I had in my neck was gone.
Well, I was bloated and had indigestion all the time, a sick stomach, and I was so sick that I couldn't do anything. I was hard to get up even to go to the bathroom. My cardiologist wanted to go back in and open me back up. Well, the surgeon thought that was going to be a little too risky.
Luckily for me, the nurse caseworker had heard some good things about a doctor who did acupuncture.
As each treatment progressed, I noticed more and more relief.
By the end of the 5 sections, I was able to walk a half a mile one way and turn around and come back.
I feel great. I mean, I feel really good.
I went from absolutely terrified and frustrated, thinking I might never walk normally again, be able to get in and out of a car, ride horses, dance. Now, the future looks very bright for me.
Health is a process of living well. And part of the role of the physician is to help the patient live well.
It's really rewarding to help a patient take some responsibility for their own problem and to tap into helping the body towards wellness, which is really what it's trying to do anyway. It just needs a jump start sometimes.
To see acupuncture help someone with a kind of chronic pain of their arm or their leg where they haven't moved it for years and they begin to have hope in their life is just incredibly powerful.
It's like treating the limb of the tree where the problem actually lies in the root. And when one starts to treat the limb, we find that the problem will reoccur. If one goes to the real cause and root cause of the problem, then things start to change.
It's kind of like one of these auto commercials, you know, if you don't go in and get the oil changed and the new filter, we'll see you later when we do a valve job. All right? Well, the acupuncturist is like, let's do the oil change, let's do the tune-up, let's not wait till you need a valve job.
Medical acupuncturists are physicians who include acupuncture in their practice of medicine. The American Academy of Medical Acupuncture sets the standard for training and proficiency in medical acupuncture. Academy members receive at least 220 hours of formal training and 2 years in practicing medical acupuncture. The Academy's proficiency examination, recognizing mastery of a full range of acupuncture knowledge, is the first step toward board certification for medical acupuncture. The Academy advocates the right of patients to seek care from well-trained physician acupuncturists in every state. The result for patients is customized, hands-on treatment, the right treatment at the right time for every person.
I know I can usually make patients feel better. I know that I can balance out their system in a way where their own healing mechanisms are started up.
I probably feel more in balance and centered than I have in years.
I have many patients that have spent literally thousands or tens of thousands of dollars on diagnostic procedures or therapeutic procedures with continued pain or dysfunction.
The problem that I have is real, and it's being treated as a real problem.
Acupuncture is a relatively inexpensive treatment for many pain problems and medical problems.
The difference in the cost between another surgery and the 5 sessions of acupuncture, well, really, you can't even compare the two.
I think that the insurance company is much happier because they've saved astronomical costs.
It brings value to the patient's quality of life and brings value to the physician's ability to make a change in that patient's problems.
I feel in control of my life again.
Acupuncture is the most powerful method of healing with the least downside of anything I have to offer my patients.
For me, it is no longer in the realm of hocus pocus. It isn't a myth. It isn't a story. or a far-out idea. For me, it's based in substance.